Hello, my name is Margaret Gray, and I am the Peer Support Coordinator and Cancer Resource Specialist of the UCSF Patient and Family Cancer Support Center. Today, I would like to share with you about our UCSF Peer Support Program. First, to the patients wanting to connect with another peer patient, and then to those who would like to become a peer support volunteer. This program is available for adult cancer patients, whether you have had your treatment at UCSF or not. Our trained peer support volunteers are here to listen to your concerns, share their own personal experience in hopes to reduce some of the emotional and practical day-to-day concerns, as well as reduce the sense of isolation that may come after a cancer diagnosis. Some of you may even lead the conversation with a clearer vision of how to set goals and make decisions just by listening to others who have completed their treatment or further along. How does this work, one may ask? You may come across the peer support program through our website, a flyer, a staff member, or another patient. On our website, there will be a brief description of the program and a link to submit your peer support request. Once your request has been submitted, it will be downloaded into a separate secure database. This helps us to identify your concerns and connect you with a peer support volunteer with a similar cancer type, treatment, or another preference. The one-on-one sharing by phone has been very effective for both the patients and peer support volunteers. You will see a little bit more about that later in this video. Where do the peer support volunteers come from? That's a great question. And those of you watching can help this program continue to grow and flourish in this area. Yes, we are constantly looking for more patients wanting to give back in this capacity with some of the most recent treatment options. Those who have completed treatment or in active surveillance for at least 6 months may potentially become a peer support volunteer. So those of you who have been helped through this program on routine follow-up appointments or identified by a staff member are all great candidates, and we would love to have you. There are a few steps prior to becoming a peer support volunteer, and the first one is a questionnaire, a detailed training, and completion of documents and confidentiality agreements. We want this program to continue to be safe for both you and the patient. Here are a few lines of testimonials both by patients and peer support volunteers. So, those of you who need support, we are here for you. Those of you that want to share and help others, we would love to hear from you. Together, we can make a difference. Thank you. Thank you.